Well, welcome everybody. Thank you for joining us today. We'll go ahead and get started. Just wanted to, there we go, make sure we're recording. I'm Martha Shapiro, and I'm the Director of Programs here at Senior Concerns. So thank you for logging into our seminar series. For those of you that are not familiar with Senior Concerns, I just want to briefly let you know about some of the wonderful programs that we provide for the community. We operate a caregiver resource center. So if you are caring for an aging loved one, we are here to help. We have support groups and we can provide one-on-one care consultations at no charge. We also have senior advocates that are here to answer any questions that you might have about resources, benefits, Social Security, Medicare even, you name it. You can just give us a call and talk to a senior advocate. We also operate the Meals on Wheels program for Thousand Oaks and Newbury Park. And recently we have started operating a volunteer grocery shopping service for seniors, as well as an emergency pantry service with non-perishable food and household supplies. And we have some new programs that we're starting, including an in-home comprehensive geriatric assessment program. That one does have a fee, but it can really be a wonderful resource for you and your family to have a social worker come to the home and provide a comprehensive assessment. And we are also starting up a new Think Fit program, which will be online. It's an evidence-informed fitness program for your mind and memory. Lots of great information on these new programs are available on our website, or just give us a call if you want to learn more. So today's seminar is a very important topic right now. It's all about Medicare and what we need to know for 2021. We are recording this presentation and it will be available to view on our website. So if you want to go back and review it, or if you have any friends or family that missed it and would like the information, you can go to our website at seniorconcerns.org/seminars. And you can see all of our recorded seminars, as well as all of our upcoming seminars, and click to register for them. So make sure to go check out what we have coming up as well. So today we are viewing this in our webinar mode. So all of you watching are in listen-only mode. That means we can't hear or see you, but you can still communicate with us. If you move your cursor on the screen, you should be able to view a chat box as well as a box that says Q&A. So you can use the chat box if you need to speak with me, if there's any technical difficulties that I need to know about. Or if you have questions about the presentation, you can type them into the Q&A box. And when our presenter finishes her main presentation, then we will make sure to answer all of the questions that are in the chat box. So, without further ado, we will get to our main event. We are having this wonderful informative seminar today presented by Gail McElroy of McElroy Insurance Services. Gail is an experienced health insurance professional helping Medicare members navigate through their health insurance options. With over 17 years in the health insurance arena, Gail provides valuable insight and education on applying for your Medicare benefits, understanding your coverage, explaining your options, and assisting in enrolling or making plan changes. She can work with you one-on-one and provide personalized Part D drug analysis, as well as doctor search to assure that medications and preferred providers are covered. Gail, a California licensed health agent, is appointed by the major health insurance companies. She also provides information on Medicare supplement plans, Advantage, and Part D prescription drug plans. So I thank you so much, and I turn it over to you, Gail.
Well, good afternoon, everyone, and thank you for joining us to talk about this very important topic. And I want to thank Senior Concerns and Martha Shapiro for inviting me. They do provide such a valuable service to all of we Conejo Valley residents. So it sounds like we have a very large group today, and we're going to talk mainly to our Ventura County, but I know we might have some Los Angeles County and perhaps even other county residents joining us today. Plans do change a little bit from county to county. So today we will concentrate predominantly on Ventura County. Also, because we have a large group, we'll have a variety of people. Perhaps many of you have been in Medicare for many years, and you're looking for the newest 2021 benefits, which we are going to go over some of the changes. But some of you may still be working. You're Medicare eligible, but you're looking to retire and perhaps enroll in Medicare. We'll address those folks. And we may have some people that are not quite Medicare eligible yet, but are planning retirement. And Senior Concerns is a great resource for everyone, and they can provide you with my contact information, which will also be up at the bottom of on the screen at the end of our presentation today, so you could reach out to me separately. Anyway, go ahead, Martha. She's sharing the screen, and we'll be going through the presentation.
That got weird. Okay.
There we go. Okay, who's presenting? Well, that's me. Okay, and just as an aside, I am not employed by Medicare or for CMS, which is the Centers for Medicare Services, or any of the insurance carriers. But I do help Medicare beneficiaries to get through all of the confusion of their Medicare options. I don't charge any fee. Everything I do is complimentary, and we are compensated through the insurance carriers. Go right ahead. Okay, so eligibility for those of you who may not have Medicare yet. You do need to apply through the Social Security Administration. And given we have COVID, everything is done online. I'm happy to give you the way to apply. If you haven't applied yet and you need your Part A and Part B, I can provide you with the websites, and it's a pretty easy application process. You are eligible if you're 65 years or older, or if you have certain disabilities. You do have to be a US citizen or legal resident for at least 5 years. And again, there's some contact information here through Social Security. I can also help guide you. To the right is a sample Medicare ID card for those of you that don't have one yet. That is what it will look like when you do apply. It will have your name, an encrypted Medicare identification number, and the effective dates of Part A and Part B. And that's our eligibility. The next page. So there are two paths to getting Medicare. The first, of course, is to apply through the Social Security Administration. So you need to get Medicare A and B. Path one is Part A and Part B through Medicare. It helps pay the hospital costs on Part A. Part B is your doctor and outpatient care. Okay, this is going to include primary care doctor visits, specialist visits, diagnostic testing, physical and speech therapy, durable medical equipment like oxygen and wheelchairs. That's all Part B. Part D stands for drugs. It helps pay for prescriptions. So if you choose path one, you would apply for Medicare A and B. Then you would purchase an additional Part D prescription drug plan and review and enroll in a supplemental plan. So that's path one. We'll review more in depth. Path two is called Part C. Part C are Medicare Advantage plans. In Ventura County, they are predominantly HMO plans. There is one PPO plan for 2021. We'll go over that later. So the Medicare Advantage Part C plans are provided by private insurance companies. Okay, so that is, you still have to enroll in Part A and Part B with the federal government, but when you enroll in a Medicare Advantage plan, your benefits come through a private insurance company. Okay, and then Medicare pays a fixed fee to the plan for your care. Next page. So that path one, just to elaborate, original Medicare. On the left there, it says Part A helps with hospital costs. Usually people don't have to pay for Part A because you've worked and through the payroll system, you've paid into the Medicare system. So Part A is available to anyone 65 years or older. And even if you're still working, you can get your Part A, simply apply and let them know. There's a deductible if you only have Medicare Part A. When you're hospitalized, you'll pay $1,408. That's the 2020 amount. We have not heard of any increases yet for 2021, so that may be a good thing. This resets every 60 days. So every 60 days, if you're hospitalized, you would pay another $1,408. This is with original Medicare, no additional supplemental coverage. This is just original Medicare benefits. Part B, it helps pay the doctor and outpatient care. there is a monthly premium that you must pay the federal government. And if you can share that, Martha, we'll give you an idea of what the premiums are for Part B. These are the 2020 Medicare Part B premiums. Medicare Part B is not free, regardless of how you've worked. It would be potentially for our low-income Medi-Cal members. But if you are not a Medi-Cal member, you can expect to pay the premiums that are listed here on the screen. It is based on your joint taxable income if you're married, or your individual single income as you report on your tax return, okay? So they keep track of your taxable income because they coordinate with the Internal Revenue Service. So these are your gross incomes. If you can look at the grid, most people will pay $144.60 a month for their Part B. If your income exceeds the first row there, you'll then go to $202, and it goes up from there. So you can see that Medicare can be very expensive for those in higher income brackets. Also be aware, if you have 1 or 2 or 3 years during retirement where you have an increase in income, the Internal Revenue Service will report that to Social Security, and your premium will go up for that year. Okay, so they'll adjust every year. So be careful about what your taxable income looks like. And I think we're done with that screen. All right, so that's the cost of Part A and Part B. Part B, there is a deductible. It's currently $198. It's set by the federal government. That is not changing at this point. We haven't heard of any increases for 2021, so we're hoping that will be true for 2020 as well. This is our 80%, 20%, 80-20. That means the federal government pays 80% of your doctor appointments and outpatient care, and you're responsible for 20%. That 20% does not have any financial limit. So as you can see, there's no maximum out of pocket. So this is why people would like to, you should be reviewing supplemental plans if you would like to stay with Medicare A and B, to pay that 20%, either a part or all. On the right side there of the screen, Part D, that's the drug coverage. You do need a drug plan. You do not by law have to enroll in a drug plan when you are first eligible for Medicare, but you will be penalized if you don't. So be prepared for a penalty if you choose not to enroll in one of the plans. The plans are provided by insurance companies. The government no longer covers prescription medications. That's since 2006. The coverage is optional, as it says, but be prepared for the penalty. There are premiums. For 2021, we'll have premiums as low as under $10 a month, and they'll go up to over $100 a month. We'll go into more Part D details a little further in the presentation. Medicare supplement insurance coverage is optional. As I mentioned, it's the insurance that will cover the 20% and the deductibles that original Medicare doesn't cover. Normally has a premium, and that is true. The premiums will vary from plan to plan. They will also vary with age, and they will vary with home zip code. So be aware that one premium does not fit all in the supplemental world, okay? Premiums do go up every year based on age, but you cannot be denied based on medical conditions. There's no denial if you enroll during your eligibility period when you first enroll. Next slide, please. Okay, still under, let's see, I think we've covered that one. The next one, if we could.
Didn't move, did it? There we go.
There we go. Okay. Advantages and disadvantages of what we call supplement plans or Medigap. Depending on the plan, they will cover all or a portion of the deductibles and copays. These plans are standardized by the federal government. They have letters associated with them also. We have a lot of letters in Medicare. So we know we have Medicare Part A and B, which we're discussing now. Part D, we'll go over Part C, and then we have supplement plans that range from Plan A to Plan N is the last plan we have. So lots and lots of letters, a lot of confusion, but we'll go through some more of that. They're very flexible. There's no network of providers. So when you have original Medicare plus a supplemental plan, you can see any doctor that accepts Medicare. 93% of all doctors accept Medicare in this country. Almost 100% of all hospitals accept Medicare. Okay, so the supplement plan is the secondary payer, or as the word says, supplement. It supplements what Medicare pays first. So you won't need to worry if your doctor accepts the supplemental plan, as long as they accept Medicare. That's the key. Be sure you find a doctor that accepts Medicare. And as I said, most Ventura County doctors, physicians accept Medicare, but you do want to ask. There is lots of the plans to choose from, but not all carriers offer all plans. We have about 25 different Medicare supplement insurance carriers in the state of California, and it is state to state. So if you're from another state, you've moved here recently, or if you're moving to another state, you will want to look at plans in that state when you move, and you will have a window of opportunity between 30 and 60 days to make a plan change when you move. Beneficiaries are guaranteed the right to buy a Medigap or supplement plan during their open enrollment period, but that is not our annual open enrollment period. So this is a big confusion for our Medicare members. So open enrollment, which begins on Thursday, October 15th, it runs to December 7th. This is open enrollment for our Medicare Advantage and our prescription drug Part D members. If you are a supplement plan member, your open enrollment is not during annual open enrollment. Your open enrollment is your birthday month. Whenever your birthday month is, that's the month you can change carriers. So if you're already a member, that leads to a lot of confusion in Medicare. So do feel free to reach out to me after if you would like to discuss changing your Medicare supplement plan. Let's talk about the disadvantages, the right side of your screen. Plan premiums can and do change every year. It's based on age. So if you start with a plan at, let's say, $150 a month at age 5 or 66 or 67, you will see a 3 to 5% rate increase every year due to your age. Okay? Prices do vary significantly from carrier to carrier. So you do want to watch your premium increases and check with an agent if you have one. Find a trusted agent who can help you navigate through the plan rate increases. I will say typically when one carrier increases rates, most of the carriers will follow because they're all experiencing the same kind of cost increases. Okay. The other important thing about supplemental plans, you want to consider enrolling when you first become or enroll in Medicare Part B. That's either when you retire or when you turn 65. If you wait till outside of that period, and that's 6 months, after that time, you may not be eligible for a supplemental plan. That too has a lot of confusion. It is not guaranteed, okay, after your initial enrollment period. Okay, Martha, if you want to, next. Okay, Part D, we've talked about this a little bit. These are our drug plans. These are standalone. So as I mentioned, the government does not cover prescription drugs. You do need to enroll in a Part D prescription drug plan. There are over 30 different prescription drug plans available to us in California. They range, as I said, in premium. They also range in benefit, and they range in which drugs they cover, okay? So the advantages, you get help paying for your prescription medications. Some medications will be as low as a 0 copay. Other medications will have a higher copay. Depends if they're brand name drugs or generic drugs. So each year during this open enrollment period, you have a chance to shop for a new plan. And you will want to do that each and every year to look at the plans available for the coming year, starting Thursday. So each plan is different. Each carrier can choose a drug list or a formulary, and your drug may or may not be on their formulary list. So this is why it's important to shop every year. There's lots of resources that I can tell you about to shop for plans. There will be a deductible on all plans under a certain monthly premium. In 2021, you can expect to pay a deductible for some of your drugs if the plan premium is under $80 a month. $80 a month. There'll be a deductible, and that deductible will range from about $250 to a $445. That amount is set by the federal government also. You'll find copays for your drugs anywhere from $0 to approximately $100, depending on the drug itself and the tier level that it falls in. Tier 1, Tier 2, 3, 4, or 5. You'll also, as we know, pay a premium to the insurance company just to have the plan. Okay? There's catastrophic coverage for those that have very expensive medications. There will be a catastrophic coverage that starts at just over $6,600 in 2021. So the disadvantages, the plans vary greatly. And so you do have to shop every year, find a trusted agent who will help you navigate through that. There's no reason to pay a higher premium does not necessarily get you a better plan. Many of my clients will ask me, tell me they like the best plan. There really isn't a best plan in the prescription drug world. It's just a lot more complicated. We'd like to make it we'd like to have the government make it simplified, but it hasn't yet, okay? So plan benefits, there is the premium that you pay each month. There's a deductible you may be responsible for, and co-payments that can change because we do have what we call a donut hole or a coverage gap, and we have this catastrophic coverage that we went over. So there's a lot of complexity to D plans. We'll go, I'd be able to chat with you about that off this presentation, specifically because everyone has a different need when it comes to drugs. Okay. So if your drug is not covered by the formulary, your doctor can ask for an exception to have it covered temporarily until you get to open enrollment again to choose another plan. All right. You can choose, as I mentioned, not to enroll in a plan, but if you choose not to enroll for more than 63 days, or if you don't have an employer plan, you can be penalized, and the government will penalize. Next screen, please. Okay.
Oh, that did not work.
That's the same one. Yeah.
Okay. Hold on.
No worries.
Okay.
All right. So let's summarize Path 1. Okay. Path 1 is a original Medicare. Everyone needs to enroll in a original Medicare A and B through the Social Security Administration. Okay. Then you see it on the screen there. We know what A, B, and D are, and then a supplement plan. That is a summary of Path 1. That works most closely like a PPO. No referrals are necessary. No limits as to the doctors you can see based on if they accept Medicare, as we talked about. So that's a summary of Path 1. So expect to pay Medicare for your Part B, expect to pay a Part D drug premium, and expect to pay a supplement premium as well. Okay, you'll have 3 cards too: a Medicare ID card, a prescription drug ID card, RX card, and a supplement card. That's Path 1. We'll go into Path 2. All right, Medicare Advantage. Medicare Advantage plans are also called Part C. Okay? In Ventura County, most of our Medicare Advantage plans are HMO plans. So I'll speak to Ventura County as I'm assuming most people are from our county. There are medical groups that doctors participate in, a group of doctors, and then they will contract with the insurance company. Medicare Advantage plan also includes Kaiser Permanente's. They have a senior program. It is a Medicare Advantage plan. And maybe some of you have had Kaiser in the course of your work years and whatnot, and you know that you see one particular doctor, your primary care. They refer you to specialists within their network. Kaiser is one Advantage plan. We have about 7 or 8 other Medicare Advantage carriers in Ventura County, many, many more in Los Angeles County. So if you're an LA County resident, you have a lot more plans to review and consider. There's, let's see, so the way a Medicare Advantage plan works, it's a single plan offered by these private insurance companies, and they combine A and B, and usually they include D, your drugs. So I like to explain it that Medicare itself, although you continue to be a member of Medicare, you have all your rights under Medicare and your entitlements, and you continue to pay Medicare, the premium of Part B. But Medicare goes to sleep and allows the insurance company to provide you with your benefits. Okay? So you cannot use your Medicare card along with your Advantage card if you decide to enroll with Advantage. You will only use one card, your insurance company's card, your Medicare Advantage card. So as I mentioned, you do have to be enrolled in Part A and B to be eligible. You must continue to pay for Part B and be enrolled in A and B. We have mainly HMO plans, as I mentioned. We do have one new PPO plan for 2021, okay? And that's going to be available on the 15th to enroll in for January 1st. And I can give you more details about that. It's also listed on the Medicare.gov site. All the plans are listed there, okay? It does take a little maneuvering to get into that site, but once in there, the Medicare.gov site is very informational, okay? If you join the Medicare Advantage plan, you do not need a supplement plan. Also, if you have an employer plan, you normally do not need a Medicare supplement plan. For those that are still working and have an employer plan, likely you don't need to enroll in Medicare A or B at all because your employer plan is going to be your primary payer and you won't need Medicare or a Medicare supplement plan. Now that's up for review. You can contact me. We can review those. Doing a cost analysis is very helpful because you are allowed to leave an employer plan to take Medicare and a supplement or Advantage, but you are not required to leave your employer plan and enroll in Medicare. Okay, again, I can speak more to that to those who have questions. All right. Next slide, please. Okay, closer look at Part C Medicare Advantage. The advantage is convenience of a single plan. So if you enroll with one of the insurance companies, that will be the provider of your services. You show one card to doctors, hospitals, and at the pharmacy. They provide all your benefits. In Ventura County, most plans do include Part D drugs. If you are a VA member and you receive your medications from your VA benefits, you can enroll in a plan that does not include drug coverage and continue just to get your medications through the VA. If you are a member of the VA, you can have a Medicare Advantage or supplement plan. So those folks do want to reach out after the presentation. If you're interested in additional benefits above and beyond your VA, you will not be giving up your VA benefits to enroll in an Advantage or supplement plan. The benefits must be the same or better than original Medicare. So this is the time of year you'll be shopping for plans and you will see all of the airwaves full of advertisements for Medicare plans. And they will include additional benefits like dental, vision, transportation, over-the-counter benefits, meal delivery, things of that sort. These are all included in Medicare Advantage plans. These are not included in original Medicare, and supplement plans do not include these inside the plan either. Most do not. Okay? So you have extra benefits in an Advantage plan. Eligibility is not affected by your health or financial status, so you can enroll during the open enrollment period regardless of your health. Okay? We have new rules for people with end-stage renal disease. In 2021, if you do struggle with ESRD, you can enroll in the Medicare Advantage plans. This is new for 2021. We have had many more limited plans prior to this year, 2021. The disadvantages of Medicare Advantage, the right side of your screen. In most plans, you receive your care in your area, in your county of residence. So does this mean you don't have any benefits outside of your county? No, you do have benefits. So you always have, a Medicare Advantage member always has access to emergency rooms in any hospital in the country, as well as urgent cares across the country. But if you are on an Advantage plan and you're outside of your home area and you need a doctor appointment, You will not get a benefit under your plan if you're outside of your area and outside of your network of doctors. Okay, so then you would be paying out of your own pocket. But you do have access to emergency room and urgent care. Plan premiums and terms can change year to year. Oh yes, they sure do. Right now, most of our plans in Ventura and Los Angeles County are at a 0 premium. So that's a big, big benefit. There's a 0 premium. Again, continue to pay the federal government for Part B. We can't get around that. But the premiums, there's no additional premium for your Medicare Advantage plan, at least in 2021. There are a few plans that have some premiums, but very few left. Most are 0. The terms will change. What that means is your copays will change, and they do every year. So those of you on an Advantage plan and a prescription drug plan, every year you should be receiving an annual notice of change. It comes from your current insurance carrier, and it comes in the late September or early October, and it gives you an idea of what your plan is going to look like in 2021. If you like what you see and you've been enjoying the benefits under the plan, no further action is needed. Your plans will simply renew in January. If you'd like to review new plans, this is your opportunity, October 15th to December 7th. Okay, and last on that page, if you're out of your area for greater than 6 months, you will need to find a new plan. So if you're planning to move out of the area and you're on an Advantage plan now, and then you make a move later, you'll have an open enrollment period to enroll in either an Advantage or a supplement plan in your new area. Okay, the government does protect Medicare members to change their plans. You can review plans there, but you do have a window. Please don't let that go past 30 to 60 days on most plans is what you have. 30 to 60 days in a new area to change plans. Okay, next slide, please. Okay. So as I mentioned, HMO type of plans, that's predominant in Ventura and Los Angeles County. We have only really one PPO plan for 2021. And as you can see, the HMOs, you generally choose your physician in a network of doctors and hospitals. And in Ventura County, the groups that participate in the Advantage plans are doctors that participate and are part of Regal Lakeside Heritage medical groups, Seaview Medical Group, and Valley Care Medical Group. Those are the 3 big medical groups in Ventura County. In Los Angeles County, there are many more medical groups just by virtue of population. And those are going to include Healthcare Partners, which is now renamed to Optum Network, Facey Medical Group, Regal Medical Group. There's many, many other medical groups. UCLA Medical Group, Cedars-Sinai has a medical group. These are all available to you under an Advantage plan. Care received outside of the network, unless it's an emergency, is not covered. I think we went over that. And many plans do include prescription drug coverage and those additional benefits, dental, vision, hearing benefits. Most plans have additional benefits. Okay, PPO types of plans. This is a PPO Advantage plan. This is different than a supplement plan. These two typically, they can have a premium. They can have a monthly premium. You have more freedom to choose. You can choose any doctor that accepts Medicare. There's also a network. You go outside of the network and you will pay a little extra to see that physician. But there are people that do, you should review the PPO plan to see if it works for you. It is higher cost to you than the HMO plan. Higher cost in terms of doctor visit copays, hospital stay copays, deductibles, higher costs under PPO. FS plans are not available in our area. Next slide.
Good, because I did not know what they were.
Yeah, yeah.
Now I know what.
Yeah, there you go. Okay, eligibility. Who can enroll in an Advantage plan? You have to be entitled to Part A and enrolled in Part B. If you don't have A and B, you cannot enroll in an Advantage plan. You normally will pay your Part B premium. Oh yes, you have to keep paying your Part B premium. You have to live in the plan service area. So you may have friends or family that live in another county or another state and tell you all about the great plan that they have, and they advise you that you should enroll in that. It may not be available to you, okay? So if reviewing every year based on your zip code, you'll see what plans are available. And again, you would have received a booklet in the mail. It's called Medicare and You. Every Medicare member receives one, but there's also a downloadable PDF. I can send it to anyone who's interested. It's going to show you all the Advantage plans that are available in our county. Okay. You must not have ESRD. That is changed for 2021. So if you do have ESRD, do please reach out to me. I can show you the plans that are available to you now in 2021. Election periods. This is very important. You can't enroll in these plans anytime you want to. In any Medicare plan, whether it be supplement or Advantage, there are windows of opportunity, open enrollment periods. There are election periods, and the first one is called IEP, and that's your initial enrollment period, typically when you're first eligible. Now, if you're still working, you don't have to enroll in Medicare A and B. Now, I want to say that you should check with your HR department. They will have some information for you. They'll reach out to be sure that you continue to keep your coverage. But your employer plan typically is the primary payer. It does vary if you work for a small employer or you're self-employed or you work with a very small company. You may need to have Medicare. So do ask your HR people. They should know. And if not, reach out to me and I'll guide you through that. Don't miss that initial enrollment period. When can you enroll in Medicare? 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. So most people want to get their Medicare as soon as possible if they're retired already or don't have an employer plan. So you want to start looking 3 months before your 65th birthday. Okay? Even if your birthday is mid-month or not on the 1st, your benefits will begin the 1st of the month. Okay? AEP, annual election period. That's what we're in starting Thursday, October 15th to December 7th. Your time to change Medicare Advantage Part C plans to another carrier plan or your prescription drug plan. This is not the time to change your supplement plan if you're already a supplement member, unless your birthday is in October, November, or December, and then you could. So I know that's very confusing. Do let me know if you have any questions on that. SEP, OEP. That's new. We just, that started just a year or so ago. We now have a new election period. Those that are on an Advantage plan, once December 7th is over, your new plan or your plan continues in January. You may change plans between January 1st and March 31st, and that's 2021, by the way, coming up, if you don't like the plan that you chose. So yet another opportunity for Medicare members, Advantage members, to change their plan. This is not true for drug plan, prescription drug plans. This is only true for your Advantage plan. So if you've inadvertently enrolled in a plan that you thought would be good for you and then realized another plan would be better for you, you can change plans up until March 31st, 2021. Again, that's somewhat new, last year or two. The last one there is the special enrollment period. There are special enrollment periods that open up. One is becoming eligible for low income subsidy. Medi-Cal, LIS, extra help with your prescription drugs, that gives you an opportunity to change plans. Also, if you move out of the area, as I mentioned. Okay, next slide, please. All right, closer look at Part D, inside the Medicare Advantage policy. Part D, your drug coverage is included in most Advantage plans, and there's no extra cost for that. So you don't have to pay any additional premium for your drug plan. You'll only have one ID card. It will be from the insurance company that you choose. The disadvantages, you are limited to the formulary of the, that's the list of drugs on the Medicare Advantage plan. Plan formularies and co-pays can change from year to year, and they often do. This is why you have a shopping period, October 15th to December 7th. Next slide, please. So that's path 2. Okay, so we've already discussed path 1. This is path 2. If you decide you would like a Medicare Advantage plan, again, enroll in A and B. Take a look at and review all of the Plan Cs or Advantage plans in your county of residency. Look at the different types, HMO versus PPO. You'll want to look to see if your doctor participates in the network. Okay, there's lots of resources for that, by the way. So an agent can help you. Medicare.gov, the insurance companies' websites will have provider finder links. They also still have paper directories. Formularies, that's the list of drugs. That will vary from plan to plan. So you do want to review your drugs every year with your current carrier. Benefits and premiums also change. But again, for 2021, most plans don't have a premium. You want to enroll in the plan that suits your needs best. So, and this may be true within the household. For one spouse, the one plan may work. For another spouse, another type of plan may work. So you do not need to enroll in the same plan. But at the bottom there, it says you will continue to pay your Part B premiums. Oh yes, if you do not pay the federal government for Part B, you will be disenrolled from Medicare and the Advantage plan. Next slide, please. Part D. We've gone over, go ahead.
Sorry.
There you go, no worries. Okay, Part D, we've pretty much gone over this. You want to review the list of drugs, okay? Not all drug lists are the same from carrier to carrier. Medicare provides guidelines, but it is not drug specific. So you may be on an insulin or a blood pressure medication. There's 20 or 30 of them on the market. Most carriers will cover at least a few, but they may not cover yours, okay? So you want to be sure your drugs are covered. There'll be different co-pays, and these are significant copay differences depending on the plan you're on. Also, every plan, they use step therapy. That means that even though your doctor may want you to be on a specific drug, the insurance company has the right to say you need to try less expensive drugs first, or we will not cover that expensive drug that your doctor is recommending. But the doctor can ask for an exception request, and many times the carrier will allow that based on how you react to the lower priced drugs. Perhaps there's something that doesn't allow you to take that drug, an interaction of some kind. There's prior authorizations and quantity limits. These are all cost containment things used by the Part D insurance companies. They all have cost sharing. You will pay for most drugs. Some drugs are as low as zero copay, so there are some that are zero, but most drugs will have a copay. Generic drugs are a really effective way to lower your costs. Please try the generic drugs if your doctor agrees. You'll save a lot of money that way. Also, very important, pharmacy network. If your drug company, your drug company will have a preferred pharmacy, please try to use one. Usually they're very big pharmacies. CVS, Costco, Walgreens, Rite Aid, Walmart, they all have contracts. They will give you the cheapest, your least expensive medications, okay? So you can use any pharmacy you like, but your least expensive cost is going to be with a preferred pharmacy. If you're already a Part D drug member, contact your carrier and ask them, where's my closest preferred pharmacy? Big difference in price between a preferred and a non-preferred or standard pharmacy. Late enrollment penalty. If you choose not to enroll in a drug plan, it's fine. You'll just be penalized when you do. And that penalty adds up pretty quickly. It is a penalty that is assessed on every month that you don't enroll. And then it's assessed for the years that you did not take a plan. It's tacked on to the plan premium once you do enroll in a plan. And you're penalized every month for the rest of the time you're on Medicare. So it really adds up. So it's always smart to consider enrolling in a drug plan, even if you don't take any drugs. Just enroll in one of the least expensive drugs to be penalty proof, okay? And you may need a drug, so you might want to have a plan. Next slide, please. Okay, the coverage gap. Briefly, we'll go through this. Those of you on Medicare, I'm sure, are very familiar with the coverage gap. We used to call it the donut hole. The initial coverage limit in 2021 is going up to $4,130. What does this mean? This means when you enroll in a Medicare Part D prescription drug plan, you may or may not have a drug deductible up to $445. That's going to be the 21 deductible. Your plan may or may not have one. You may have to pay for some of your drugs up to $445, and that will affect tiers 2, 3, and 4. And for those that know what tier levels are, it's whether they're generic or brand. When you and the insurance company have paid out of your pocket and the insurance company has paid out of theirs $4,130, you reach the coverage gap. You will be notified every month by your Part D drug plan how close you're getting to the donut hole, because they send you a summary. Please review that summary every month. It's also available on their portals, but they mail it to you. They want you to know how close you're getting to the donut hole. The donut hole starts at $4,130. So let's say you're on a drug that you pay $3 a month for. The insurance company might be paying $40. It is the $40 plus the $3 you're paying that goes towards that $4,130. So it isn't just your copays, it's the total cost of the drug. Okay? Coverage gap, that's the donut hole. Once you're in it, if you do get to that, and if you're on generic drugs only, you're likely never going to hit the coverage gap. But if you take expensive medications, you might hit the gap in a month or 2 or 3. And then when you go to the pharmacy to pick up your medications, you'll wonder, what happened? Why am I paying so much more for my drugs? Why has the cost of my drugs changed? It's because you're in the coverage gap. At that time, you'll pay 25% of the cost of your drugs. Now, if it's a $10 drug, $2.50. If it's a $100 drug, $25. If it's a $1,000 drug, $250. So this can be very, very expensive for those of you that have to take expensive medications. This is why generic, if you can take generics, if one is available, talk to your doctor about changing to all generics. Okay. Lastly, there's a catastrophic coverage after you have paid out of your own pocket. For 2021, it's $6,550. This is out of your own pocket. This is not out of the insurance company's pocket. Once you've reached $6,550, you'll reach the catastrophic phase of coverage for the rest of the year. You'll pay 5% of the cost of your drugs, and the carrier will pay 95%. Very confusing year in and year out. Medicare.gov does a job providing information. Senior Concerns has information, and the agent can provide you with information. Okay, next slide, please. Okay, if you need extra help, as we look here, extra help is available for people with low incomes and few assets to help pay for their costs of Medicare. These are through the county of either Ventura, Los Angeles, wherever you live. This is our Medi-Cal program. Medi-Cal is our California program of the federal Medicaid. So it is administered through the county. So you'll want to reach out to the county and apply for Medi-Cal. They will provide you with whether or not you qualify. The income levels are quite low, but it doesn't mean you shouldn't try to apply. Do check their websites. The county websites will tell you what the levels are. You can also get prescription drug assistance, low income subsidy it's called. This is both a federal and a state program, just to help you with your drugs. It's easy. It's a higher levels of income to get the LIS, low income subsidy. You see on the right there, for single people, your extra help starts when your income is around $18,000. For married folks, $24,000, and then your assets between 0 and $27,000. So that's if you fall in that category, you are eligible for extra help and do apply. There's the phone number at the bottom for Medi-Cal. You can also Google that. They're local. There's an 805 number, and there's a 213 or 818 number for LA County. There's the number for HICAP. That's a health insurance consumer advocacy program. They help people particularly with their drug and doctor research and providing help. What plans would cover your drugs and your physicians. Next slide, please. And that's a free service, by the way, HICAP. Appeals and grievances. If you have had any services declined, you can file an appeal and a grievance, and it's very powerful, appeals and grievances. You appeal to the insurance company that you have your plans with, then you can also send an appeal directly to Medicare, and they will look at appeals and grievances. And I've had a few people be very successful in filing a grievance when something hasn't been covered for them. Next slide.
Did I do it?
That's it. Okay, I think we're done, aren't we? Yeah, any questions? So from my perspective, I'm happy to answer questions today. I know that Martha probably has questions in the queue. Here's my contact information after today. Please feel free to email me anytime, call me. There's my work phone number as well as text that phone number. I can answer some questions or we can review. We have between the 15th of October and December 7th. Let me just review a couple more things before we go to that. Couple things. There's an, for 2021, we haven't reviewed that. ESRD, insulin, any of our diabetic members, if you can pull that up. Martha has a list. We have a new program. Anyone who's on insulin, the following companies are providing insulin for $35 per month. So if you see your insulin listed on this document, this is also listed on Medicare.gov, you will have a lower cost sharing in 2021 if you enroll in an insurance plan that's participating. So please, 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 if you take insulin, reach out to compare plans to be sure you get that $35 per month. Also, Medicare. How do you find a doctor that takes Medicare? Number one, you can ask the doctor. They all know. The front offices are very, very good at that. And also visit medicare.gov/physician. Very simple. You put in your zip code and it will show you all the doctors in your area that take Medicare. Other things that are new, acupuncture is going to be covered by Medicare going forward. 12 acupuncture visits within 90 days for chronic low back pain. Okay, telehealth. We all know about COVID. Telehealth is being covered. Most carriers are covering that with no cost. Each carrier will differ with COVID response in terms of hospitalization, medications, and care. So you will want to reach out to your member services. The phone numbers on your ID card. They're very helpful. Okay, questions?
Great. I am going to stop screen sharing so I can better see the chat because we've had some questions as you've been talking. I think this one was answered, but specifically, how does Kaiser fit into this in terms of flexibility?
When you're a Kaiser member, all of your services come through Kaiser, just as if you were an employee with a plan that was a work-related plan, or if you were on an individual plan. So you would not get any services outside of Kaiser. You would use Kaiser physicians, hospitals, and centers.
Okay, thank you. And here's somebody who's turned 65 in March and will work through June with their employer insurance. Do they have to select A, B, C, and D before they turn 65, or can they wait until they retire in June?
If your employer has more than 20 employees, that's considered a large group. You check with your HR department, but you should not have to apply for Medicare A or B or D if you're on your employer's plan. You do have to be enrolled in your employer health plan. That's called creditable coverage. So the government wants you to have coverage somewhere. So if you have an employer plan, your employer's plan should be creditable. And if it is, you don't have to do anything until you retire. So those that are going to be retiring in the future, start about 2 to 3 months prior applying for Medicare through the Social Security Administration.
Thank you, that's very helpful. What is ESRD that you've referenced?
End stage renal disease, kidney disease.
Okay. And does Blue Cross have a Medicare Advantage plan in Ventura County? I assume.
Both Ventura, LA, and most of the counties in California, yes. HMO plans, yes.
Okay.
Advantage and supplement, by the way. They have both Advantage and supplement plans.
Okay. Now, I have several in the chat, so I need to clarify here. Okay. So here's somebody that says they have A and B, they're retired and they're getting it through their wife's eligibility and wanting to know what is Medicare Advantage and the cost. Well, you've discussed what Medicare Advantage is, and the cost, I'm assuming, is going to depend on the plan.
So the Advantage plans in Ventura and LA County, almost all of them are zero additional premium. So that makes a very good point, though. If you are on an employer plan, whether you're the dependent or the active employee, if you are sharing in some of the monthly premium, and oftentimes a spouse and children are charged something to the employee for their plan. Perhaps the employee is 100% paid by the employer, but the employee's dependents, the employee has to pay with payroll reduction. So you will want to review what your options are. If you're paying more than $150 or $200 a month to the employer, you want to look at moving to a Medicare and an Advantage or supplement plan. Do a cost analysis. I do that regularly for people. So you definitely want to look into that.
Okay, thank you. With Part C, can I choose my doctor if they take Medicare?
No. So Part C plans are Advantage plans. Most of them are HMO plans. So the Health Maintenance Organizations, HMO, that acronym, you choose a primary care physician inside of a medical group. That these groups of doctors are very large groups of doctors. And they do include, in our area, as I mentioned, the Regal Lakeside Heritage Group, the Seaview and Valley Care Group, UCLA Medical Group, Cedars-Sinai Medical Group. You choose a doctor in one specific group, and you're referred inside that group only.
Okay, thank you. Okay, let's see. I think we just got some more. I did want to mention that Carrie Salas, who is our fabulous social worker with our caregiver program, typed into the chat for everybody the local number for our HICAP program in Ventura County. HICAP stands for Health Insurance Counseling and Advocacy Program, and it's run through our county as a way to provide non-biased counseling for these insurance programs. And like Gail mentioned, they can also evaluate if you are eligible for any of the extra help programs. Our county also has a benefits eligibility center as well, so they can help you if you do think that you might qualify for Medi-Cal. They can actually help you with that application, which is very important. Okay, here's another one. I am unemployed at the moment and will turn 65 in February. I do plan to continue working, but I'm not currently working. So should I enroll in Medicare or wait and renew my Covered California insurance and hope that I get a job with employer insurance?
So Covered California is very expensive unless you are eligible for a financial subsidy through Covered California. As long as you're not 65, they will enroll you. But at 65, they don't want you to be a member anymore. So you will get a cancellation notice. So because Covered California Financial Assistance is a government program and Medicare is a government program. So you cannot have both. So you want to do a financial analysis as to whether it's cheaper for you to try to stay on Covered California. They don't want you to stay on Covered California past age 65, but I will tell you that the system doesn't always catch up to those that are turning 65. And so you may continue potentially to keep that plan, but you will definitely behoove you to review Medicare A and B. As I mentioned, Part B is $144.60 a month for anyone making the first level of income. And then the Advantage plans are zero premium. So if you're paying anything more than $145 a month, you'll want to seriously consider Medicare. Also, additionally, if you go back to work after you've been on Medicare and you no longer need Medicare A and B because your employer plan covers your medical expenses under their plan, you can disenroll from Medicare. Just let Social Security know that you have an employer-sponsored plan now, and they will disenroll you and re-enroll when you retire permanently.
Got it. Thank you for that. And another question, you mentioned acupuncture. Do all of the Medicare plans cover this, including in LA County?
They will in 2021 because that's new to Medicare. So as we mentioned under the Advantage plans, they have to cover everything original Medicare covers or you're entitled to. So as long as that is a new benefit under Medicare, the Advantage plans must, and they actually all do. They all cover acupuncture. Yes.
Great, and I think we're down to our last question, which is when and how do I inform Medicare about my change in income, if it's going to affect your premium?
Yeah, so the only time you will interface with them because of your income changes is when you're first eligible. After that, they check on you through the Internal Revenue Service, and you don't do any reporting. Yeah, they'll pick that off of your tax return. But that first year you retire, and this is important, if you retire in 2020 or 2021, we haven't filed our 2020 tax returns yet, so they don't have your 2020 income. They also don't know that you're retiring, and your income may be going down. You might be having a decreasing income, but the government only has your 2019 filed return. So that first year, you may have been full-time working, your spouse may have been full-time working, and your income may have been 300, 400,000. It could be significantly higher. There's a form that can be filed to request that they not charge you additionally because you've had a life-changing event. And it's about a 2 or 3 page form. It's pretty straightforward. And you just file it with them, requesting them to charge you the lower amount based on the fact that you retired.
And what month do they make the adjustment on your monthly premiums?
The first month you're eligible. So if you're aging in, let's say in March, they will adjust it for the first month and for the next 12 months until your tax return is filed again, and then they'll look at your tax return.
Okay, we're just going to do one more question and then we will finish for today. You mentioned that there will be one PPO in Ventura County in 2021. What is that PPO?
Yeah, so Aetna has what we call moved into Ventura County. So they're going to be offering both an HMO and a PPO plan. And again, these are all listed on our Medicare.gov site, as well as in your 2021 Medicare and You booklet. And so all the details should be there. You can reach out to me separately and I can show you details as well. There will be a monthly premium on that PPO plan, and there will be higher costs to you on a PPO plan than on an HMO plan. Okay, so a premium plus higher cost to see doctors and hospital visits and things of that sort.
All right, well, thank you so much, Gail. This has been such useful information, and I know more questions will come up for people, so we are happy to follow up. I wanted to mention that our next seminar will be on October 27th, and it is, will you pass your next driver's test? So this is always a popular topic. We have Tressa Thompson, who is the DMV Senior Ombudsman, who will be presenting, talking about the written test and changes going on at the DMV, and so that will be very useful. And then in November, on November 10th, we have Dr. Carlo Reyes from Los Robles Hospital, who will be providing an update on the state of COVID in Ventura County. So both of those, you can go now to our website and register so that you can join us on those days. So I want to thank you all for joining us, and thank you again, Gail. We so appreciate you taking the time to speak with us today. And if anybody needed the papers that I showed with the different numbers, the premiums and things, if they need them emailed, just reach out and I'm happy to send them to you. So I thank you so much, and I hope you all have a wonderful evening.
Thank you. Bye-bye.
Bye.